pentazocine, ibuprofen. Excess of these things can predispose you. Herbal medications. And in the US, there is a popular candy that has licorice inside. That's the name of the thing inside, and ephedrine. So if you excessively take these things, it can predispose you. Nicotine too is part of the drugs that can cause this. Other causes, hypothyroidism, hyperthyroidism, and pregnancy too is a risk factor to hypertension. We can see that it's very common in women that are pregnant and then all of a sudden they develop hypertension. It's also a risk factor. Now, for the signs and symptoms, some people don't get symptoms. We call it asymptomatic. They don't show symptoms. Whereas some people might now start having symptoms when the blood pressure starts getting too high. They will now start complaining of headache. It's very common. The first thing they will complain about is severe headache. Then we have some that will have chest pain, they will have dizziness, difficulty breathing, nausea, vomiting, blurry vision, anxiety, confusion. Some people also get nosebleeds, and abnormal have been diagnosed with hypertension. The person will go for several investigations to make sure and rule out that some organs are not affected. Rule out that some organs are not affected. I mentioned earlier that you should have your BP checked on 2 to 3 separate occasions using the BP machine, the one that we know. And they usually check it both in standing position and sitting position. So once that has been done, then we can now go for other investigation like your full blood count, urinalysis, fasting blood sugar. Remember I mentioned something about diabetes being closely related with hypertension. So it's always important to check your glucose level. You check your kidney function test, liver function test. Also check your cholesterol. Cholesterol is very, very important. Very, very, very important because it can pose a very high risk to someone getting heart attack, heart failure, and even stroke. So I'm going to talk about modalities that will help us curb our cholesterol level for those ones that have high cholesterol. So we'll check that. Also ECG and other ones. Now, preventive measures and treatments that we can do to help ourselves, especially when there is like a family history of hypertension. Now, our target is to bring down the blood pressure to lower than 140/90 in patients with hypertension and other organ affection. If you understand that. Do we understand that? So we have to bring it down to lower than 140/90. Whereas for those people that are in high risk with hypertension, those ones with cardiovascular disease, that's the heart disease, diabetes, or chronic kidney disease, we target to bring it down to 130 millimeter mercury. Now, first things first is lifestyle changes. You can't start medication when you are still taking alcohol, when you are still eating all the pastries and all the oily foods. You can't start antihypertensive drugs because it will be like pouring water in the basket. It won't help, it won't do anything. So the first thing is lifestyle changes to help lower the blood pressure. Now, general measures that we can take is eating healthy. I know if we start asking everybody how much fruits we take in a day, a lot of us don't even know the last time we bought apple or orange. It's that bad. So eating healthy, your vegetables, your fruits, they should come in handy. Low salt diet. For those people that like to buy food outside, you don't know the contents, the amount of salt they put in the food. You don't know. And that's why when you finish eating outside, you come back, you'll be wondering why your BP is 200 when you just finish eating salt outside. So the best thing is to make your food yourself, or if you can get the knowledge of the salt they put in their food outside, which I doubt you will get. But the best thing is to always to curb your salt diet. At least 2 grams per day is what is recommended. Now, if you're overweight or obese, you have to lose weight. So get physically active. Go and do exercise, do something. You can't live a sedentary lifestyle. You have to move around. Now, you can get at least 150 minutes per week for intensive aerobic activities. Now, for the elderly people, you don't have to carry weights or start gymming or all these things. You can just wake up in the morning and then start walking just like this. Nothing too serious. Just make sure your cardio is working. And then you can just go around your house and back. It will really help. Then also, for those people that smoke, you have to quit. Alcohol too, you have to quit. Now, after that modification, lifestyle modification, and general measures, the next thing is now the medications. And this is where your doctor comes in, because they are in the best place to tell you the particular antihypertensives that will work for you. And even while you are still on the antihypertensive, you still need to be going for checkup to make sure your BP is actually normalized. If not, they will have to make changes to those drugs. There are different classes of medications. Your doctor will tell you more about that one. Next, please. Okay, so now you get diagnosed of hypertension and you are just like, okay, let me just stay at home and be using what